For 2 generations, you were told that the yolk of egg was dangerous. You were told it raised cholesterol, caused heart disease, and killed people. Welcome back to ACE's Health and Medicine. I'm Dr. Jingduan. Today I'm going to walk you through egg across all 4 ACEs dimensions: anatomy, chemistry, energy, and soul. And by the end of this episode, you will see 2 things. First, you will know the truth about eggs. Second, and this matters more, you will have watched the ACEs model in action. And after this episode, you will be able to apply the same method to any other food, any other drug, or any other health claims you encounter for the rest of your life. Let's begin. The story begins in 1968. The American Heart Association issued a recommendation: no more than 3 eggs per week. From that moment, for the next 40 years, the egg yolk was treated as a poison in the American diet. We threw away yolks and we ate egg white omelets. We replaced the butter with margarine. We bought low-fat everything. We taught our children to fear the food their grandparents, their great-grandparents ate every day. Then something began to shift. In 2014, Time magazine put butter on its cover with the headline, "Eat Butter." Slowly, quietly, the device changed. In 2020, the American Heart Association published a science advisory in its journal, Circulation, acknowledging that the effect of dietary cholesterol on blood lipids is modest and variable. They dropped strict cholesterol limits. They shifted to a dietary patterns instead. The PURE study, published in 2020 in the American Journal of Clinical Nutrition, followed 177,000 people across 50 countries and found that 1 egg per day was not associated with an increased risk of cardiovascular disease compared with none. A 2020 study from Harvard, published in the BMJ, polled 3 of the largest American health cohorts, 215,000 nurses and male health professionals followed for over 30 years, and a meta-analysis of 1.7 million people. Same finding: moderate egg consumption did not increase the risk of heart disease. 40 years of advice. Wrong. The question is not just, what about eggs? The question is, how did the most credentialed medical institutions in the most advanced country in the world get something this basic, this wrong for this long? That is why eggs are the perfect test case for the ACEs method. To understand what really happened, you cannot just look at the chemistry. You have to look at all 4 dimensions. Let's get started. Anatomy. Let's begin with the physical reality. An egg has a shell, calcium carbonate, with an organic matrix, a shell membrane underneath it, then the egg white, called albumin, which has 4 distinct anatomic layers. Then the valine membrane wraps the yolk. Then the yolk itself, with a germinal disc, the place the baby chicken would have started growing. 2 anatomic components, white and yolk. These are not interchangeable. They are different organs with different jobs. Now, follow what happens when you eat that egg. The protein in the white goes mostly to your muscle. That's the part everyone celebrates. But the yolk, that's where things get interesting anatomically. The cholesterol in the yolk doesn't pile up in your arteries. It goes to specific anatomic destinations. It becomes part of every cell membrane in your body, trillions of cells. Cholesterol gives those membranes the right fluidity to function. It builds your adrenal cortex, the part of your kidney where stress hormones are made. it becomes myelin sheaths, wrapping your nerve cells, the insulation that lets your nerve system fire correctly. 25% of your brain dry weight is cholesterol. It goes to your gonads, where it's converted into testosterone, estrogen, and progesterone. In your skin, it becomes a precursor to vitamin D when exposed to sunlight. The choline in the yolk, and we'll come back to this in the chemistry section, goes to the synapses in your brain as a building block of acetylcholine, your memory neurotransmitter. It also goes to your liver to prevent fatty liver disease. The lutein and the zeaxanthin in the yolk, these are carotenoids that go specifically to your retina, to a tiny structure called macula. They are the actual chemical that protects you from age-related macular degeneration, the leading cause of blindness in adults over 65 in the Western world. Vitamin K2 in the yolk, especially in the pasture-raised eggs, goes to your bone matrix to deposit the calcium where it belongs, and prevents calcium from depositing in your artery walls where it doesn't belong. So, when somebody tells you, throw away the yolk, what they are really telling you is starve your brain, starve your retina, starve your bone matrix, starve your nerve insulation, starve your hormone-producing organs. The anatomy already tells us the device is wrong. That's the anatomy dimension. Now let's go to chemistry. C. Chemistry. This is where modern medicine got food. Here is the basic mistake of the original cholesterol hypothesis. It assumed that cholesterol you eat goes directly into your bloodstream and clogs your arteries. Simple input-output. Eat cholesterol and blood cholesterol rises, heart disease follows. It sounds reasonable. It's also almost entirely wrong. Your body makes 70 to 80% of your cholesterol itself in your liver, in your intestines, in your adrenal glands, and even in your brain. There's a beautiful regulatory enzymes called HMG-CoA reductase, the same enzyme that statin drug inhibit, that controls cholesterol synthesis. This enzyme is regulated by feedback protein called SREBP-2. Here's what SREBP-2 does. When you eat more cholesterol from food, it senses that and tells your liver, make less. Then you eat less cholesterol from food, it tells your liver, make more. It is thermostat. Your body adjusts. Dietary cholesterol does not equal blood cholesterol for simple reason that your liver is constantly compensating. There is a famous case in the medical literature that proves this. In 1991, the New England Journal of Medicine published a case report about an 88-year-old man in the United States who for at least 15 years ate 25 whole eggs per day. 25. His daily cholesterol intake was 5,300 milligrams, 18 times the recommended limit at the time. His blood cholesterol, 200 milligrams per deciliter, completely normal. LDL, 142, HDL, 45. No clinical signs of cardiovascular disease. How? The researchers studied him. They found that his intestine absorbed only 18% of the dietary cholesterol. Most of us would absorb about 50%. His liver downregulated cholesterol synthesis. His excess cholesterol got shunted into the bile acids and excreted. His body compensated. He is one extreme case, but the principle generalizes. For the vast majority of healthy people, dietary cholesterol is not the driver of the blood cholesterol. Now let's talk about what is actually in the yolk chemically. A single egg yolk contains 147 milligrams of choline, An egg white contains about 1 milligram. That's not a typo. The white has essentially zero choline. Why does that matter? Because choline is the precursor of acetylcholine, your brain's primary memory neurotransmitter. It is also required for liver to package fats for export. Without enough choline, you get fatty liver disease. And here's the most disturbing fact in this entire episode. According to the National Health and Nutrition Examination Survey, about 90% of American adults do not consume enough choline. Pregnant women, when fetal brain development is most dependent on choline, only 8.5% meet the adequate intake. For 40 years, we told women to throw away the yolk. Then we wondered why so many children had attention and cognitive challenges. Let me give you one more chemical factor. The yolk contains lutein and zeaxanthin, the eye protective carotenoids I mentioned earlier. Now you might think, I'll just eat spinach instead. Spinach has more lutein per gram than egg yolk. But here's what research shows. The lutein in egg yolk is 3 times more bioavailable than the lutein in spinach because it's bound to the lipid matrix of the yolk, which your gut absorbs much more efficiently. This is what happens when you ignore chemistry beyond a single number on a lab report. You missed entire molecular reality. And there's one final chemistry point I have to make, because this changes everything. In 2016, the JAMA Internal Medicine journal published a paper by Dr. Christine Kearns, a researcher at the University of California, San Francisco. She had gone to the Harvard archives and found documents from the 1960s. What she discovered: in 1967, the sugar industry paid 2 Harvard nutritionists the equivalent of $48,000 to publish 2 review papers in the New England Journal of Medicine, redirecting blame for heart disease away from sugar and toward fat and cholesterol. The 2 Harvard papers never disclosed their funding source. Those papers shaped dietary guidelines we lived by for half a century. This is the limit of chemistry dimension alone. Chemistry can be true, chemistry can also be captured. And if you only know the chemistry that has been sold to you, you can be wrong about your health for decades. This is why we need a next 2 dimensions. E, the energy. In ACEs, E includes bioelectrical, the autonomic, the emotional flow, and the traditions that have observed these patterns far longer than Western medicine has existed. Chinese medicine has been studying the human body in details for over 2,000 years. It is not a folk medicine. It is a systematic clinical tradition with thousands of practitioners, written texts, and accumulated observations across hundreds of generations. And in Chinese medicine, egg yolk is not a poison. It is one of the most valued substances in the entire materia medica. Chinese medicine classifies tolerifying foods and medicines in hierarchies. At the top tier is the category called blood and flesh sensation substance, substance derived from living animals that carry life essence. This category includes deer antler, donkey hide gelatin, turtle plastron, and placenta, and the egg yolk. That is the company the yolk keeps in classic Chinese medicine. It is treated like a precious medicinal substance, not a breakfast risk. Now in Chinese medicine, the egg white and the yolk have different energetic properties, different thermal nature, different organ affinities, and different therapeutic actions. The white is classified as cool in nature, sweet in flavor, and enters the lung and the spleen meridians, or energetic channels. Its function is to clear heat, soothe the throat, and calm inflammation. If you have a sore throat from inflammation or infection in the body, the white is the right part. The yolk is classified as warm in nature and sweet in flavor, and it enters the heart and the kidney meridians. Its function is to nourish in energy, build blood, calm the spirit, and clarify the deep essence. If you are recovering from illness, postpartum, depleted, or suffering from insomnia due to anxiety, the yolk is the right part. So, Chinese medicine never had a Western framing of egg white is healthy and egg yolk is bad. It says there are two different medicine for two different purposes. Both have value. Here's the most beautiful synthesis between East and West I have never seen in clinical practice. 1800 years ago, a physician named Zhang Zhongjing, known as a medical sage of Chinese medicine, wrote a book called Shanghan Lun, the foundational text of classic Chinese herbal medicine. In passage 303 of that text, he prescribes a formula for severe insomnia caused by what he calls fire harassing the heart and the kidney, what we would today call agitated insomnia with anxiety, common in perimenopause and severe stress. The formula have 5 ingredients: coptis root, scutellaria root, pony root, donkey hide gelatin, and raw egg yolk. And here's the part that stops me every time I read it. Zhang Zhongjing specifies that the first 4 ingredients are boiled together. Then the decoction is allowed to cool slightly, and only then is the raw egg yolk stirred in, never boiled with herbs. Why? Because he wrote, heat destroys the yolk's essence. 1800 years before modern science discovered oxidized cholesterol, Zhang Zhongjing observed that cooking the yolk too aggressively destroys its therapeutic value. Modern research has confirmed that high heat cooking produces oxidized cholesterol species that may contribute to artery damage, whereas gently cooked yolk do not. 1800 years of clinical observation have arrived at the same conclusion that the modern biochemistry has just confirmed. And this is what the energy dimension teaches us. When two complete independent medical systems, one Western, one Eastern, one biochemical, one energetic, separated by 2,000 years and 12,000 miles, arrive at the same answer. That is the strongest possible signal that we are looking at the truth. This is what energy aids, not magic. Human experience and observations accumulate across generations are available nowhere else. So, this is a dimension modern medicine ignores most constantly, and in this story, it is also the most important. Let me ask you a question. What happens to a person? What happens to a culture when for 40 years you teach them to fear their food? Eggs are not just a source of nutrition. Across human history, egg has been a sacred symbol. Easter egg, the Chinese red eggs at birth, the cosmic egg in creation myths from a dozen traditions. The egg is the symbol of life itself, the potential of life held inside its shell. When a culture begins to throw away the yolk, that culture has done something deeper than make a nutritional mistake. It has broken its relationship with food. It has replaced trust with fear. It has separated nourishment from meaning. This is the soul dimension, and the cost of 40 years of egg fear was not just a choline deficiency or macular degeneration. The cost was that an entire generation learned to relate to food with anxiety instead of gratitude. They learned that nourishment was dangerous. They learned that their grandmothers who lived to 90 on yolks and butter and lard were wrong. I see this in my patients all the time. A 60-year-old woman has eaten egg white omelets every morning because her doctor told her to in 1995. She is choline deficient, her memory is slipping, and believes the biochemistry lies something deeper. She has lost trust in food and in her own body. She has been trained to eat out of fear. In Chinese medicine, the act of nourishment is itself medicinal. The relationship between you and what you eat affects your digestion as much as the macronutrients do. Fear corrupts digestion. Trust restores it. There is also a deeper soul question here. How did you, an intelligent adult, end up believing for decades something that was wrong? While all authorities pointing in the same direction, we tend to follow. This is a soul-level question about authority, about trust, about your own discernment. 40 years of egg advice didn't just harm your body. It taught you to outsource your judgment. And this is the wound the ACEs method is here to heal. You are not a patient in waiting. You are not a passive receiver of expert decree. You are a steward of your own health. And that means you reclaim the right and the responsibility to evaluate every health claim across all 4 dimensions, weighing them as a whole human being before you decide what to believe. The eggs you eat tomorrow are not just a food. They are act of reclamation. Now let's synthesize. Anatomy tells us yolk components goes to specific destination in your body: brain, retina, bone matrix, cell membrane, nerves, and hormones. Throwing away the yolk starves this destination. Chemistry tells us your liver regulates blood cholesterol independently of what you eat. It tells us the yolk contains nutrients, choline, lutein, vitamin K2, vitamin B12, and D that 90% of Americans do not get enough of. And it tells us the original cholesterol scare was, at least in part, the result of sugar industry funding that shaped Harvard nutrition research in 1967. Energy tells us that 2,000 years of Chinese clinical observation place the yolk in the same medicinal tier as a deer antler and donkey hide gelatin. And it tells us that ancient observation about not overheating yolk anticipates modern biochemistry by 1800 years. So tell us 40 years of fear-based eating broke a culture's relationship with food, taught us to outsource judgment, and harms people in ways no lab test can measure. While all 4 dimensions point in the same direction, that is conviction. For 99% of people, whole eggs, yolk included, are nourishing food. The 40 years warning was wrong. But this episode is not really about eggs. This episode is about teaching you a method. So before we close, let me give you the 5 principles you should apply to every future health claim you encounter, using this episode as the proof of how they work. Principle 1. Consensus is not truth. In medicine, every generation has its certainties that turn out to be wrong. Stomach ulcers were caused by stress until Barry Marshall proved they were caused by bacteria and won Nobel Prize. Hormone replacement therapy was prescribed to all menopausal women until 2002, when it was shown to increase breast cancer and stroke. That was a wrong conclusion too, which led to a second bigger mistake, that the woman should not be prescribed all hormone replacement instead of being given appropriate hormone replacement and appropriate time for appropriate Dosage. Again, margarine was healthier than butter until we discovered trans fats. Eggs were dangerous until they were not. Principle 2. Follow the incentives. When a recommendation conflicts with the food industry's interests, scrutinize it carefully. When a recommendation aligns with someone's profit motive, sugar, farmer, processed food, be deeply skeptical. The Kearns 2016 paper is a proof that even Harvard, even New England Journal of Medicine can be quietly captured. Principle 3. Be away simple narrative. Eat less food of X, get less of disease Y is almost always too simple. Chronic disease are multifactorial. If someone is selling you one villain story, they are usually selling you something else too. Principle 4. Respect traditional wisdom that has survived selection. Your great-grandmother ate eggs and lived to 90. 2,000 years old Chinese medicine considered yolk a precious substance. These are not folk superstition. They are accumulated wisdom from long time horizon than any randomized controlled trial. Principle 5. Do not replace one dogma with another. Right now, there is a wave of new voices. Dr. Eric Berg, Dr. Ken Berry, Dr. Paul Saladino, Dr. Asim Malhotra, telling you to eat 6 eggs a day, that all carbs are toxic, that meat is the only honest food. 10 years from now, some of their certainties will probably be reversed too. The goal is not to switch tribes. The goal is to develop your own 4-dimensional method, so you don't need a tribe at all. This is ACE's method. Today we walked one health question, eggs, through all 4 dimensions. You now have something more valuable than the conclusion about eggs. You have the method. Next episode, we'll do the same thing with a different topic, sleep or statins, or anxiety or cancer screening, or something else that matters in your real life. Different topic, same 4 dimensions, anatomy, chemistry, energy, soul. Same method. After 5 or 10 episodes, you will not need me to walk you through it anymore. You will have internalized the framework. You will walk into your doctor's office or read a news headline or sit down to a meal and you will think across 4 dimensions automatically. That is the goal of ACEs, not to give you answers, to give you the framework that produces answers for the rest of your life. If this is what you came here for, subscribe, tell someone in your family, ask them, when did you last eat egg yolk without fear? Then go and eat one and know what you are really doing. You are reclaiming your relationship with food, with your body, with your own ability to think clearly about your own health. You are not a patient in waiting. You are a steward of your own health. I'm Dr. Jingduan. This is ACEs Health and Medicine. I will see you next time.